So, hi everybody. I am Shannon Rudisill. I know many of you, but not all of you. I am the executive director of the Early Childhood Funders Collaborative, and I'm so happy to be able to host this along with our colleagues at Grantmakers Concerned with Immigrants and Refugees. And Early Childhood Funders and Grantmakers Concerned with Immigrants and Refugees, affectionately known as ECFC and GSER, have been working together for I would say about 3 years on issues related to kids and families who are immigrants, kids living in immigrant families. And a shout out to Annie E. Casey Foundation, who I believe is on the phone, because it was actually Annie E. Casey Foundation that first introduced GSER and ECFC at this moment where there's been so many critical threats to children and families from immigrant backgrounds. So we're really excited about the project that we're co-sponsoring this funders briefing for you today. This is with the Children's Thrive Action Network, and we're going to turn it over and let our folks talk to you directly about what they're doing together. But I just thought I would say a little bit about what's exciting about the project to me, and that's the folks who were involved. So I will say, first of all, I have an MSW, I'm a social worker. So when I saw that they had added the National Association of Social Workers to the steering committee, I was super excited about that because happy to see my profession being so proactive in this way. But this opportunity is truly cross-sector because we have, longtime federal policy advocates paired with professional associations in education and social work, paired with folks who work at the state level, like Myra, who have significant health expertise, but also, state advocacy expertise. And Unidos US, right, was, leading national organization, and Hannah. So it's just a really interesting and I think innovative and a little bit unusual partnership that's come together. And the other thing that I will say is that I've talked with Wendy Cervantes, who can't be here today because she just had a baby, Hannah Matthews from Classes in her stead. But as we started talking about this project a year ago, one of the things we were talking about was the upcoming election and how different. There will be a tremendous amount of work no matter what happens in the election in November, but the nature of the work will be different, right? In terms of whether it's about undoing terrible things and trying to build back a culture of inclusion, for the health of America, or whether it's, I don't even know how to think about that, how things we keep fighting about to try to defend families. But the way that this network is structured seemed like an extremely flexible, multi-sector, cross-sector way to be prepared to be able to do whatever needed to be done. So I just wanted to say those words about why this was an exciting project for us. And then I will just let you know who we have on the phone with us to speak to you about it today. We have Hannah Matthews, the Deputy Director of the Center for Law and Social Policy, and I believe, as she said, the Acting Director of Immigration and Immigrant Families since Wendy had her baby. We have Carlos Guevara, Associate Director for Immigration Initiatives at Unidos US. Myra Alvarez, President of the Children's Partnership in California, and Emily Butera, Senior Policy Advisor at Open Society Foundations, who's an early supporter of this work. So I believe I am turning it over to Hannah to start. Is that right? All right.
That's right. Thank you, Shannon. And that's a great introduction and took some of my exact words. So it's absolutely perfect. There could be nothing better than getting a presentation about the value of this network. So we're really thrilled with that introduction. Thank you. Yes, I am Hannah Matthews. Many of you may have been expecting to see Wendy. She is home with her 2-day-old baby. So I am happy for her and thrilled to be here in her place and talking, and just want to say thanks, first of all, to ECFC as well as GSER for hosting us today. We were actually did an initial briefing in the fall for ECFC, and when I think about how much the network has really grown since then, but also how much the urgency and the agenda to really protect and support children of immigrants has also changed in that time, given that that was before the pandemic. It just really underscores, I think, the importance of this network. So our agenda today is to start with a little bit of context about why these organizations have come together around an agenda that centers children of immigrants. Myra will start with that, and then Carlos will also discuss the impact of the COVID-19 pandemic on immigrant families. I'll then share more on the development and the structure of the CTN network, and we'll, yes, definitely want to save lots of time for questions. So with that, we'll turn it over to Myra to get us started.
Great. Thank you, Hannah. And thanks for the opportunity to join you all today. It's been wonderful working with our partners as part of this important network, and really excited to be with you all. So first, as a state child advocacy organization based in California, we really recognize the role that the network can offer our shared goals for the well-being of not only our state, but our nation's children, particularly those from marginalized communities. And the work of the network is focused on children in mixed status immigrant families. And just so we're all using the same language, we're referring to those families with at least one citizen and one non-citizen member. It's considering the unique needs of this population that's particularly important as we consider policy changes for the future, but also as we consider the current policy landscape and its impact on these kids. When you look at the child population of our country, the diversity of our nation's children is very much driven by the children of immigrants. As you can see in the map in front of you, an estimated 18.5 million children under the age of 18 have one or more parents who were born outside of the United States. That's roughly 1 out of 4 children in the country. But the share really does vary by state, to as low as about 3% of kids in West Virginia. But in some states, then the overall numbers are significantly higher. 1 in 3 children in Texas, and half of children in California, for example, have at least one immigrant parent. The vast majority of these children, practically 95%, are US citizens, but it's being part of an immigrant family that has specific implications, which we're going to discuss with you today. And then finally, just one more fact. Among these children, more than 7 million live in households where neither parent is a US citizen, and more than 5 million live in households where at least one family member is undocumented. Next slide, please. And as I shared, children in immigrant families, they're a large growing population of young people. And in recent years, they've been a key driver of population growth amongst children, but also the increasing racial and ethnic diversity of our country. I think this is particularly important to keep in mind, given the narrative around immigrants in this country. Latin America continues to be the region of origin for the parents of the majority of children in immigrant families. But about a quarter of parents of children in immigrant families are from Asia, and roughly 7 to 8% are from Africa. And for African immigrants, it's a share that has almost doubled in the last 10 years. So as we work to collectively change the narrative on immigrants in this country, who they are, where they're from, what they contribute, it's critical that we make clear the diversity of our immigrant community. And in doing so, we can better address the intersectional nature of the challenges children in immigrant families are facing. Next slide, please. And part of the work that we do or seek to do as part of this network really is recognizing that there are both moral and fiscal reasons to strengthen our commitment to all kids. I think as a society, caring for kids is fundamental to our values, it's essential to our economy, and it's the investments that we're making in their well-being today that's going to pay off in the future in terms of our economic impact, productivity, and their contributions to society. And it's because of that that the work of this network matters. Children in immigrant families are more likely to be a part of families where workers are employed in low-paying jobs. Despite the many efforts that many of you support of funding efforts to expand coverage for children, we know that children in immigrant families consistently are more likely to lack health insurance. And in general, they're more likely to be underrepresented in critical safety net programs like Medicaid, like SNAP. And we know this was true before the current political environment that has negatively targeted immigrant communities, and why we have so much more work to do now and to ensure that we're shifting that, that reality in the future. the current administration, through anti-immigrant rhetoric, exclusionary policies, limiting eligibility requirements, but also through increased interior enforcement, has really further the negative impact on kids and their access to these vital services. For example, they've made parents a priority for deportation, which has led to more deportation of parents than were previously granted under some discretion by the department. With more deported parents, you have more traumatized children, more children that have the risk of higher economic insecurity, food insecurity, housing insecurity, and other negative impacts. And then it's also many of the policies that we've heard in the news and that we know to be true, whether it's the attempts to remove DACA, attempts to dismantle TPS as we know it, really creating this increased uncertainty and stress for immigrant families and their children. We know that these policies are intended for specific immigrant communities, but they have indirect impacts on their children. And that is the work that we want to do as part of the network. And I say all of that knowing that most of us, or almost all of us, are likely at home, also dealing with the crisis of COVID-19. And that is also negatively and disproportionately impact our immigrant community. And to talk about the specific impacts of COVID-19, I'm going to hand it over to Carlos.
Hi, everyone. Thank you, Mayra, and thank you, everyone, for joining us today for this important conversation. Just briefly, my name is Carlos Guevara. I'm the Associate Director at Unidos US for Immigration Policy. Unidos US, just by way of background, is the former National Council of La Raza, the largest Latino civil rights advocacy organization in the nation. We've been doing this kind of the work for the past 50 years or so. So it's very natural for us to be engaged in a conversation around children and the importance of essentially the next generation of kids who are going to essentially power the country forward. So we're honored and really privileged to be part of this collection of groups here that's taken this work forward. For us, top of mind right now, it's interesting. We started our conversations during this past 3-year environment focusing on the nearly 6 million American kids that have at least one undocumented family member in this country. We know many of them are Latino, but as we heard from Mayra, the immigrant population is very diverse. Focusing on the many challenges they have from the restrictive immigrant environment that they currently live in, and the threat of losing a loved one and what that means for their futures. But in some ways now, to add kind of insult to injury to the past 3 years, it's largely the same population that is dealing with many of the disproportionate impacts of what we're experiencing through the COVID-19 pandemic. So just by way of background, and I fully just want to acknowledge and appreciate that, while we from our perch focus on advocacy on behalf of Latinos, we know that this information is a little broader than that as we look at all immigrant populations. But we know that in terms of the health impact, just for starters, which we can't have this conversation around COVID and impact without starting there, in my view. We know that Latinos, many of which live in mixed status homes, make up about 1/3 of the COVID-19 cases for where race and ethnicity data are available. That number, when you start to factor in other populations, it's going to be larger. And it's also going to be larger because of just the lack of data that we have in this moment and the challenges. As of earlier this month, we only had about 50% of available data to tell us about the true impact. And in states like Texas, where we know that Latinos make up 40%, again, many in mixed status homes, ethnicity data remains unavailable, or it did as of July 2nd, for 90% of reported cases and 78% of deaths. So we know that the impact, combining, the fact that we're not just looking at Latino populations, even though that is a big share of the immigrant population, the data lags, and then the third piece, some of the sociological factors of the negative impacts of 3 years, in some cases many more years of harsh immigration landscape, are impacting this very community, the nearly 6 million American kids in these households. We know that many have been largely excluded, as we'll talk a little bit more about here shortly, from any form of response or relief from the federal policy packages, the 4 that have been moved forward at this time. While at the same time, many of those conducting or working in essential jobs that are powering this country forward. We know that immigrants represent about 20% of workers in some of the hardest hit industries, service provision, hospitality, agriculture, and so forth. And there's also an important point to recognize is that the spectrum of immigration, if you will, is dynamic. We know that folks who have temporary protections under DACA and temporary protected status, another form of temporary relief for folks, have been in the crosshairs of this administration and are also at risk of losing protections as we speak as well, and many filling critical health and essential jobs in this moment. So we know that the challenges before us and this constituency, this group is significant. All at the same time, while many of them are been asked to, or because of necessity, been required to step up and fill essential jobs. So it's our position, frankly, that the country owes it to them to respond in kind. Can we go to the next slide, please? Okay, so, sorry, I'm experiencing a bit of a lag. Okay, to be fair, in the packages that we have seen some provisions that have been helpful for many Latino families, many immigrant families, and we've listed some of these here as well. Funding for the COVID-19 testing, for example, for the uninsured. So the idea being that as folks feel sick, they can go and figure out if they're testing, and some plus-ups for community centers. But there's some limitations to this, which we'll discuss shortly. We cannot decouple, and we're finding it difficult to decouple the conversations around testing and the conversations around access and care and affordability, which then in turn undermine the complete pandemic response that we're seeking at this time. We have seen, to be clear, some economic supports for families, some immigrant families, including DACA and TPS holders that have Social Security numbers, where every family member does have a Social Security number. So as an example, let's say 2 DACA parents with 2 American kids may in theory be eligible and have been eligible for economic supports under previous packages. But as we'll discuss shortly, many more have not. We've seen expansions in nutrition assistance, including very critically for the Latino community and immigrant populations, the pandemic EBT, which in many ways fills gaps in nutrition via schools. The children who are receiving a free and reduced lunch, for example, may be able to continue to receive that through this, including those who have parents who are undocumented. And the expansion of unemployment, to be clear, has including for independent contractors, you can argue for certain mixed status families has had some impacts where at least one person is a breadwinner and has lost their job, may have been able to avail themselves to that relief. But again, not everybody in that family. So if we can go on to the next slide, please. So many, we would submit, immigrant families have indeed been left out of the response and continue to be, and advocacy efforts are underway as we speak, as the Senate has come back to try to remedy many of these issues. But some of I would highlight 3 glaring pieces that we would lift up is what I was alluding to earlier in terms of the gap between testing and care. Without some of the restrictions on Medicaid and SNAP, we'll talk about SNAP momentarily, but some of the restrictions on health access through Medicaid, we know that families are facing very difficult decisions between even going to get testing at all if they fear having a big bill left afterwards. And that puts pressure on, for those who do seek care, on hospitals and community centers who, while again receiving some semblance of support, we know it's not enough. So that's one of the big gaps and vulnerabilities, I think, that could potentially undermine our response to the pandemic and how families are being left out. The other, as it pertains not only to health, but also to the nutrition piece, is the fact that many of the prohibitions on immigrants, including lawful permanent residents who have been in the country for less than 5 years, including DACA and TPS recipients, that prohibits them from accessing themselves SNAP benefits, CHIP and other critical nutrition and health supports remain in place, remain unchanged, despite advocacy efforts. And we know that those, combined with the fact that we have faced an anti-immigrant environment, anti-family environment of the past 4 years, that has done tremendous damage in the willingness for families to come forward to seek out help, even where they have eligible children to obtain those benefits, are really undermining the efforts to address the pandemic in this moment as well. And then the last piece, if we can go to the last slide, please. So we talked a little bit about health, nutrition. Just a note on the economic supports. We know, just briefly before talking about the ITIN issue, we know that many families are, where both breadwinners are undocumented, are going to be largely cut out from the pandemic unemployment insurance, the robust pandemic unemployment insurance program as it currently constituted. But whatever modicum of support that we were hoping to get those families and the patchwork of state support that's going on in states like California would be ameliorated in part if we were able to get cash supports to mixed status families by way of economic impact payments. But the CARES Act, unfortunately, barred families where even just one family member lacked a Social Security number or even filed taxes with what's known as an ITIN number, a tax identification number. So efforts are underway to remedy that unacceptable and excusable gap. But many immigrant families, even where there are some individuals, and you see the figures here on the slide, the tune of, by some estimates, I think we should update this, but by some estimates, according to the Migration Policy Institute, about 5.5 million U.S. citizen spouses and children with Social Security numbers were left out of any form of support. So I would just then leave that piece there, but we touched a little bit about some of the concerns there as we face the pandemic with respect to health, nutrition, and the economic supports, and why this work right now and our advocacy together is very important, not just in the context of COVID, but more broadly. So I'll turn it over now, I believe, to Hannah, who will take us forward.
Yes, thanks so much, Carlos. So I think you heard about the urgency of addressing the needs for children in immigrant families. About 1 year ago, CLASP co-hosted a convening with the Women's Refugee Commission and other partners to strategize about whether it might be possible to center children of immigrants in an advocacy agenda. I think, you heard Carlos talk about how immigrant families have been left out. I think oftentimes it's not clear to many Americans, to many of our partners, that in fact, those families include millions of citizen children. And those are the kinds of messages that we really want to get across to understand how large scale these impacts really are for millions of children, those 1 in 4 children in immigrant families. So we convened a cross-sector group of participants to represent immigrant rights groups, children's groups, faith-based groups, and other sectors, and had agreement that a focus on children was important, but really missing in advocacy on immigration. And so the idea of a network that could engage children's advocates as well as others on these issues emerged. You can see on the slide, the CTAN's mission is to defend and support children in mixed status immigrant families in the United States. Our ultimate vision is a society in which all children have all that they need to grow and to thrive, and that their diversity and background is celebrated and valued, regardless of where they or their parents were born. We see this network as critical to advancing a comprehensive pro-immigrant advocacy agenda that centers children, and in particular to engage allies who may be concerned with the well-being of children on immigrant issues, but may not have found other ways to be able to engage directly on immigration issues. Next slide, please. We know there are, many coalitions and campaigns to advance immigrant rights. I think all three of the organizations on this call are involved or leading others, but none of them have an intentional focus on the comprehensive well-being of those 1 in 4 children in immigrant families. Our goal is to mitigate the harm of anti-immigrant policies and actions for children in the short term, but also to advance positive policy outcomes in the long term. We do this work with several guiding principles. One is to lead with a child well-being approach. So our advocacy is not limited to a particular children's issue. We are assessing policies and practices for our engagement from a child well-being lens. So taking a comprehensive view on healthy child development, thinking about children's nutrition, about their caregivers, economic security, kind of the whole range there. We really want to engage a diverse cross-sector group. I've mentioned that this started by listening to folks who thought that we could bring together children's groups and immigration groups. We really need to amplify the issue and build a more powerful advocacy strategy by engaging across sectors. The network has a robust communications and messaging focus. We think telling the story of children in immigrant families to a range of audiences nationally is really important, again, to really convey the scale of impact. And finally, we are hoping to ultimately build out a structure that both promotes a policy and advocacy agenda, but also engages practitioners in the work. We think it's important that policy solutions are being driven by people who are impacted and those who are most closely in touch with the needs of immigrant families and communities. Next slide, please. So you can see here the network structure, and in fact the creation of a network opposed to a campaign or a coalition was intentional because we do believe that it is a networked approach that has the potential to engage that cross-section of members. And so again, advocacy organizations from all sectors, but also thinking about providers, about teachers, about early childhood providers, social workers, and others who are working directly with immigrant families. You can see from the structure here, a central coordinating committee is responsible for leading the network, and I'm going to talk more about that in a moment. We then have organizations and individuals who are able to join the network as either active members who are committing to more sustained engagement in the network, participating in working groups, advancing other priorities. But people can also join, and organizations can join as allies. And so those are organizations that may have make less of a time commitment, but are supportive of the overall goals. And both active members and allies will have the ability to really kind of move up and move back in terms of their engagement with the network. When the network is built out, we do envision engagement of individual community members, which I'll also talk about. Next slide, please. So on the screen, you can see the coordinating committees. In addition to Myra, Carlos, and myself representing 3 of the organizations, we do have a diverse group representing direct service providers, children's advocates, and immigration advocates, and including state and national organizations. So we're really excited about kind of from the beginning leading with this diversity and hope that in fact that will even continue to grow. Next slide, please. So we've spent time, again, since that convening that we held a year ago, building out the structure and infrastructure of the Children Thrive Action Network. I think we are very much building the plane and flying it at the same time because, frankly, the needs of children can't wait for us to have it all in place. So we've really started our initial activities with a focus on COVID-19 relief. Most of our network activities are done through working groups, and the first ones that we are rolling out are on the screen here, all of them focused again on COVID-19. So the federal advocacy is about identifying and responding to key policy opportunities or threats as they move through Congress or the federal regulatory process as well. I'll flag that we've been, really engaged in the COVID relief efforts. We actually were able to engaged 200 children and youth organizations to call on Congress to include immigrant families in COVID relief. And much of what we've done has been to provide talking points to children's groups and others to really understand the impact of COVID on immigrant families and how they've been left out. The state working group will be tracking state level policies. We think that this will be a network that will ultimately be engaged at the state and national level. Also doing translation there to help partners in states understand those state policy opportunities. And in the short term, we've also been looking at the COVID relief opportunities and making sure that states and partners have what they need to be able to make sure that the funds that are available get to immigrant families. So for example, looking at the implementation of the pandemic EBT program that Carlos mentioned, which really is one of the few new federal resources that can actually get to immigrant families. The working group that we will hope to build out will have an infrastructure to make it easier for children's advocates to access the information that exists on immigration policy already, but really kind of play a translating role there to see children in that work. Similarly, the provider working group is where we really want to develop a model that provides education materials, training, and information to those who are working locally with immigrant children and families, but also to support their efforts to translate what they are hearing and learning from working with families, and to really engage on documenting the impact of immigration policies on children. And then finally, I'll just flag the external communications and narrative work that really is a core piece of this network. We've done significant work already to really look at existing messaging and narrative work that's been done with the goal of identifying those positive messages that humanize immigrant children and families, and really working to support partners in being able to tell the story and to talk about immigrant children and families and give them the talking points to do so. Next slide, please. So looking ahead, in the next few months, we will continue to build out the network infrastructure that will, again, bring in a broad range of organizations to become actively engaged on these issues. This includes staffing the network and also further refinement of structure. Our focus on recruiting members will continue to prioritize diversity of expertise on policies and practices across the range of issues that impact children and mixed status immigrant families, and also with a focus on non-traditional allies, so that we're really broadening out this membership base. We will continue to respond to federal and state policies that impact the well-being of children and immigrant families, mostly all focused on COVID right now, and again, continue that really important communications and messaging work to give partners the capacity to not just tell the story, but also to be able to support rapid response communication efforts as events emerge nationally and in communities. So for example, being able to respond to enforcement actions that happen in communities is one area that we're looking at. As we look a little further out, next slide please, on the long-term goals, I just want to underscore, and Shannon led with this, and it has been really top of mind for us, the uncertainty that 2020 poses really will require planning for and being able to pivot for either a defensive or a more positive proactive strategy. And so we really think that the network is a structure that will allow us to do that, even if in fact we're in a position, depending on the outcome of the election, to be able to pursue more positive policies. There will will be a huge amount of work to undo the harm to immigrant families and to support families, and also, continued work in states and at the national level to fight back. So we really are putting a network together for the long run. We also will be looking to identify states where we have partners who might be able to help us look at what it would take to actually build capacity across children and immigrant rights groups locally to advance state policy opportunities. So we're planning to pilot that in a couple of locations. And finally, the last kind of structure piece is really to create a two-way communication infrastructure. It's maybe the outer ring of that network slide, where we can really ensure that providers, immigrant parents, youth, are able to inform the policy agenda. So the idea here is that we are not just disseminating out our policy priorities, but that we are co-creating policy solutions with people who are impacted. Next slide, please. So I want to make sure to leave plenty of time for questions and discussion. So in closing, I want to underscore the approach here. Obviously, I think everyone on this call knows the impact, the recent years, the current immigration policy attacks that we have seen from this administration. They have undermined literally every facet of what we know is critical for children's development. And so that is part of the story that we are telling here. We want children's advocates and others to see immigrant children in the issues that they work on, and also understand how immigration policy impacts all of these components of child well-being as well. We really believe that increased alignment across national advocacy strategies, across sectors, is crucial to bring about change and to reframe immigration policies through a children's lens to ultimately lead to policy change. So we are excited about growing this network. It obviously requires growing our resources as well. We have a lot of nascent work that is ready to grow up and scale. We would love to talk further about partnering with any of you on the call to do that. Before we take questions, I want to turn it over to Emily Butera, who is here from Open Society Foundation. She has been a generous supporter of the network and is going to say a few words before we do Q&A. Emily?
Sure. Thanks, Hannah, and hi, everyone. It's good to be with you. My weather alert siren went off while Hannah was speaking, and my power had started browning in and out. So if I disappear, please feel free to reach out to me offsite. I'm happy to talk with any of you a little bit more deeply about how OSF came to support this work. And I just thought I'd go a little deeper on that question and talk with you a little bit as well about some tactics and strategies that might help those of you who are on the children's advocacy side and trying to think through whether or not your institution can or should make an investment in immigration work. So I know a few of you on the phone, and those who know me know that I come from the advocacy community, and before I came to OSF, most of my work focused at the intersection of immigration and children and family issues. And one of the things that I always found interesting and frustrating is that the immigrant rights movement has this tendency to focus on a lot of issues of concern, but to kind of lose sight of what's happening with children in mixed status families in particular, unless and until we face these kind of mass casualty events, like the raids that we have seen in Tennessee and Mississippi. And then there's a lot of attention on the issue, but because there isn't consistent attention, we lack the power to convert these opportunities into policy change. And at the same time, organizations like CLASP and UNIDOS and Children's Partnership and others do all of this great research and work with folks in the children's advocacy space who are really what I see as the immigration first responders in their communities. They're the people who are day in and day out dealing with the impact of immigration policy. And not just policy change, being quite honest about it, during the Trump years, although that has been extreme and devastating, but implications of policies that were put in place as well under the Obama administration. And so this is a long-term issue. And those children's advocates, I think, because they're on the ground, the educators, the child welfare workers, you all are in that community, know who I'm referring to, they have access to solutions. And those are powerful movements and conversations that, to my mind, need to be brought together if we are going to achieve real and meaningful change for kids. So in investing in this work, from the perspective of OSF, I was really drawn to the possibilities that exist in bringing these two spaces together, and to this idea that we might be able to get through some of the stickiness that holds back immigration policy change, or at least policy change as it relates to kids in mixed status families, by starting to talk about the issue as a children's issue, a children's rights issue, a family strength and stability issue, and not always an immigration issue. Being very honest with all of you, this was not the easiest sell with my leadership. And the question that I got was, why are we going to spend limited immigration dollars to fund a project that is for and about U.S. citizen kids? And so I thought I would just share with you all a few of the arguments and tactics that were helpful to me in encouraging OSF to put some support into this work. I mean, I think colleagues on the phone have said this already and said it more articulately than I can, right? But I really do think that framing this issue, if we're just thinking very strategically about it even, framing this issue as a children's issue provides a way to reshape a difficult conversation into something that's less controversial. And it, you know, it has the benefit of being true too, you know, so it's not just a cynical tactic. And those of us who've worked in this space for a while have seen, although it's kind of hard to believe in this moment, but we've seen policymakers with bad records on immigration take these votes that benefit children of immigrants because we've given them a way to approach the issue from a child well-being lens. We need to get back to that, and we're certainly not there right now, but I do think it's possible. And also, you know, others have talked about this need and opportunity that the network provides to bring allies, the teachers, the child welfare workers, the members of the clergy, and the families themselves into a movement where we really need allies, right? And regardless of the outcome of the election, as Hannah just talked about, we have a lot of work to do, not only to get back to a baseline of security and safety for these kids, but really to create a world that works for them. And COVID has kind of laid bare all of the ways that kids in immigrant families are disproportionately disadvantaged across education and healthcare and economic outcomes. And then lastly, I'll just say that that I like and I feel very strongly about the fact that that the network is approaching this work with an eye to power building and not just to federal policy change, but to also thinking at the state and local level. That lines up very well with OSF's theories of change, and also I think with the realities of where we're going to see breakthrough possibilities for immigrant families and kids in immigrant families in the years ahead. And so I think I'll stop there and to leave enough time for Q&A. But just to say, I hope that some of your foundations and institutions will be interested in thinking about ways you can support the network. I would be very happy to talk with any of you a little bit more about why OSF's making this investment, about how I brought you know, my leadership along on this journey, and just to say, Shannon and others, feel free to pass out my contact information to those on the phone, and you know, colleagues, please reach out to me at any time. So thanks for the opportunity to be with you.
Thanks. So, okay, I am in the dark now because the power has not gone out, but I have relocated to the basement. So if you lose me, Hannah and Rena will pick up with the, there's a crazy storm outside. So, David, I saw that you had a question about states, and I think there's sort of, I would love for you to talk a little bit about Missouri and ask your question. And I think we also we have a lot of state folks. So there's your specific question, but then there's maybe a question that our team wants to address about if there are state funders on the line. We had several United Ways register, like how should they think about it? So take it away, David.
Okay, thank you. I'm not yet part of our Gateway Giving group, and our director, Deb Dubin, was kind enough to flag this for me. I'm a returned Peace Corps volunteer from Uruguay. I'm involved with a tiny organization called the Interfaith Committee on Latin America here in St. Louis. As I indicated, there's an organization of 40 immigrant services providers, and I'm just getting to understand their structure. I think there are a lot of, so what I want to understand is, one, is there somewhere in this system that could help and work with this group? I'm making an assumption that they need help. I'm also a trained community organizer, and I think they do need help. And at the same time, there are folks connected, and I've done a lot of fundraising in my professional and volunteer life. There are also folks with, I think, disposable income that, if they hear this story, are potentially donors. And so I guess I'm looking for, is there any one of the folks in CTAN that has this as part of their work, definition of priorities? And if so, that would be great. And if not, I'd be happy to talk to Emily or anybody offline about this. Yeah, I don't know if that answers everything that you wanted me to cover, but I'll start with that.
Okay, why don't I start, and then Myra or Carlos, if there's anything to add. So a couple of different things. So I think the goal here is definitely to kind of, not to overuse the word, but to be networked with as many groups as possible. So I'm not sure what technical assistance at this point that we can offer directly, but I think we would love to be put in touch with the folks in Missouri and figure out what it might look like to be connected in that way. We are very early on in the network, so certainly don't have work in all the states yet. So I think that's something we'd love to think about. We've been thinking about starting some state-focused work, mostly driven by where some of the coordinating committee organizations have members, and where we have partners that are already engaged with the network. We've been talking about, and also where there's just opportunity and kids that we think would benefit from the work. We've been talking about doing some work in Colorado, in Florida, in Texas. I think if there are funders from states that are, to Shannon's point, that are interested in supporting, I mean, right now, most of the organizations that are doing the work for CTAN are doing it out of their own organizational resources. And so we are all raising money to be able to support that work. I think being able to support the work of state partners in states to connect to the network would be wonderful. So for state funders that are interested, we would love to have that conversation. And we are also, as the network as a whole, ultimately would are interested in being able to support the capacity of partners at the state and local level who don't have the means to participate in the network as well. So there's multiple levels of giving that we are interested in and would love to talk about. We actually haven't talked about individual giving, I don't think. We've been focused on raising foundation funds, but yeah, I think there are multiple ways to support the organizations on this call, the organizations that are on the coordinating committee, and potentially other organizations to be involved.
Thank you.
So a couple of the other questions you touched on, Hannah, one was, how is this funded? And the other was, how do I join? So do you want to give, I think you sort of touched on both of those, but you might want to say a little more to those.
Sure. So we do have, so I think that folks have been given, we have a kind of, we don't have a functioning website yet, but we have a 2-pager that has contact information, and there's essentially, we can link people to a sign up. So for active members, we ask that they agree to a number of principles to basically their alignment with the priorities and the mission of the organization. I don't think we have a structure yet for individuals to join the network, though again, that is something that we are working on building out. So folks should contact any of the 3 of us on the call, and we can direct you in the right place to more information.
Can I just add one thing to Dave's question? Part of what Hannah referenced as far as these subgroups, the sub-working groups, which one of them is state advocacy, is to try and leverage what efforts are already happening across the country and not have to reinvent the wheel, recognizing that immigration as a policy issue is not necessarily a priority for every group across the country, every advocacy organization. So how can we serve as resources to states that may want to learn from other states' efforts or even local communities that want to learn from other local community efforts, because not everything that is proactive and immigrant supporting has to be state level policy. There are also local efforts that can really move the needle to support children. And that sort of discussion is exactly the compilation of policies that we're collecting as part of the state advocacy working group in CTAN, and that we hope will benefit organizations that may not have the resources to do that digging themselves.
I may briefly add to this great conversation about the working groups. That's something that certainly we're giving shape to. I know within our network of affiliates, that we'd like to think that we have capacity and bandwidth to have a sense of what everybody's doing, but it's just not the case. And occasionally and part of our interest in this is to have more of a streamlined way to get a sense of these things. I'll give you one example. And in some instances, I've encouraged some of our own affiliates to consider joining one of these or many of these working groups. But one example that came to my desk, this is not in a coordinated way, but we get reports out of Arizona from one of our affiliates of this housing issue with the pandemic response that I was alluding to earlier. And there's this question about, does this trigger immigration restrictions if somebody's in the family undocumented? What impacts will that have on all this slew of questions, right? Where the children are American citizens, but it's the classic bread and butter issue that I think we're trying to address when it pertains to mixed status families. And I know those issues are being led, and I know those issues are coming up at the local level and the state level regularly. And I think one of the goals of these, not just this network, but the individual working groups, is to be able to have more visibility on what those things are, to have more of a sharing experience. And sorry for the background with the kids, speaking of my kids, and be able to share and collaborate on some of those things. So if it's folks in Missouri or Florida, where the case may be, we're able to share some of those learnings. And also, like I said, have more visibility as these issues are emerging and as elements of the pandemic response itself are presenting new issues that we have to adapt to and respond to in the moment.
Mayra, this is Dennis Johnson. I'm so glad to reconnect with you. We haven't spoken in a while since I ended my 27-year stint at Children's Health Fund. Now I'm at Cabrini Health Foundation, which is relatively new conversion foundation in New York. It's the largest in New York, and I'm joining them to help them set some of the strategic direction of the organization's grant making. Unfortunately, they're not really inclined to fund advocacy per se, but we are looking at immigration issues. That one of the populations that we've targeted for grant making support across New York State, and my concern is how do I connect with a network of providers of health and human services to immigrant populations, and particularly children, in a state like New York. I mean, there are some organizations in New York. I'm based in Brooklyn, so there are plenty of folks to connect with in New York City, but in some of the more rural areas in New York State, where there are some very significant issues around the immigrant populations that are residing in those parts of the state, I want to be able to pull together a network that I can reach out to and be informed by, to hopefully provide the underpinnings of an initiative that would be statewide. Is it possible that CTAN could be helpful with that, and from a state perspective?
Yeah, absolutely. Hi, Dennis. It's nice to be reconnected with you as well. Definitely. So not only can we refer you to specific organizations in New York, and I know Hannah and Wendy and the team at CLASP have a variety of organizations. There are others, particularly in rural communities like migrant farm workers, that have networks in New York that we would be happy to connect you with. And hopefully also in that exchange of conversation, invite those organizations to consider being a part of CTAN. I think the real goal of this network is to strengthen our collective work for children and immigrant families, and really considering rural communities, especially as our urban centers become more and more expensive for immigrant families. How can we ensure that this advocacy, these efforts are happening not only in our urban centers and cities, but also in those rural areas? So we would be happy to follow up with you and make sure you have those contacts. And congratulations on the new role.
Thank you. That would be terrific. And, I see the need, as I talk to different people around the state, that a lot of the hidden concern, a lot of the issues that are obvious to us are hidden to others. And we need to do a better job of being sentinels, so we can really give exposition to the challenges that immigrant families are facing throughout the state. It kind of gets there's a Tower of Babel effect in terms of all the things that are going on. But this is particularly post-COVID, or for those of you on the West Coast, current COVID. New York, things are a little bit better shape. But we're going to be feeling the impact, obviously, of this pandemic for quite some time, and immigrant families are really in just about the worst position relative to the economic impact. So it's that much more important that we find a way to tell those stories and to bolster the efforts of folks who are doing good work in those communities to make sure that they just don't go under completely, and they manage to bridge it over to the days ahead when hopefully things will be better.
Thank you. And I see there was a question about picking communities. I think you guys addressed it, but maybe not, Laura. So I want to give you a chance, and we have just one more minute. So I'm going to wrap mine in for the last question too, taking moderator's privilege, which is, I know NEA is one of your members, and the big question around here in the DC Metro is it's linked to COVID, right? School not reopening. And to your point, Dennis, I'll just say, I think from my experience in the DC suburbs, to Myra's point about, not all this being urban, kids who are going to lose out in this remote opening include a lot of these kids. So, it was notable you have NEA at the table. So I wonder if you want to say anything about education and then, maybe picking communities, and we'll wrap up.
Sure. So we haven't, this is actually, maybe I'll answer these questions together. So I think Laura's question is about picking, prioritizing policy issues and places. And so what I would say is that we are both thinking across the domain of all the issues that impact kids, but also trying to be really strategic about where we see enormous gaps. And because we are, sorry, I'm trying to talk above the thunder, because we are small and just starting out, for the most part, we've really been focused on the immediate COVID relief. And then also thinking that our key area is really around immigration enforcement, where I think centering kids has been particularly left out. So that's been kind of an immediate focus. I think we don't yet know where we will go. We are trying to not replicate what's happening in other places. So for example, groups that are already doing work on immigrant access to benefits, we obviously partner very closely with the Protecting Immigrant Families campaign. We partner with others that are working on issues around at the border, whereas we're focusing on children in the interior. So I think all of that is a little bit TBD in terms of the specifics, but is about assessing where we can have both the biggest impact, where we have experts in our network, and where we see some real gaps with a focus on children in particular.
Thank you. All right, well, we're at 4:01, so I just want to thank you again for attending and thank our speakers for taking time to talk to us about this network. You have contact information, and we will send out slides, and we will have the recording available. So we'll talk to the presenters if they're all right with sending the recording out widely, but I know at least one person had requested it. So really appreciate everybody's participation, and if hope that you are in a place with cool and calm weather and that you're all staying safe. So have a good afternoon.
Thanks all so much.